Hi everybody, today we're going to talk to Holly and baby Claire and Jackie and baby Thomas. And today we're going to talk about breastfeeding and bottle feeding. First of all, Holly, why did you choose to breastfeed?
I just thought it was the natural way to go, and I guess I had been breastfed as a baby, and it was just sort of the natural progression of
sort of process
things
to go through.
Yeah, I didn't really make a big decision.
And did you have any trouble starting breastfeeding?
With my first I did. Claire's my third, but with my first baby I had a lot of trouble in the hospital, like with the syringe to express a little bit of colostrum and pain as well. But after a few weeks of sort of sticking with it, it eased up, and third time round it's a lot easier.
Okay. It is tricky at first, isn't it?
Yes.
Even though all women are told that it's really natural and everybody can breastfeed, and it should be, because we think it's natural, it's going to be easy, but it's not.
It's not. A lot of people told me it shouldn't hurt.
Yeah.
And so I felt like maybe I'm doing it wrong, or maybe I'm not attaching right. Or
Did you see anybody about it?
I did, and they just saw the different positions and how the baby was attaching. And it all looked fine, so it was just me.
Okay. You know, some women do have more sensitive nipples than other women, and really it's just getting your body used to it again. Even though you have fed 3 babies, each woman is really different, and none of us are really going to know how it's going to breastfeed until we start to breastfeed. So you just may have more sensitive nipples, but as your body gets used to it and your breasts and nipples get used to it, does it settle down?
Yes.
It does. And that's pretty normal, and it usually takes about 3 months. Breastfeeding generally takes about 3 months to establish, and you feel comfortable with it, and your breasts get used to it as well.
Yep.
So it can be uncomfortable at first, and that's normal, as you found out.
Yeah.
Yeah. And Jackie, why did you choose to bottle feed?
I did start out trying to breastfeed. I really did struggle with that for quite a while. Had quite a few problems. My nipples were inverted. Thomas was having trouble attaching. I was having trouble with my milk supply, so he lost a bit of weight initially. And so we were topping him up with formula, but then my supply never really came in, so we went to full-time bottle feeding.
Yeah. How long did you try to breastfeed?
About 5 weeks.
Yeah.
Yeah.
And it was difficult the whole way.
Yeah, I ended up with mastitis a couple of times and quite a bit of damage on the nipples.
Yeah, you poor thing.
Yeah. And we tried some medication to help with the milk supply, but that didn't quite work either.
And how did that feel to you?
It was disappointing. I did feel like a bit of a failure because I wasn't able to breastfeed. But then once Thomas started thriving on the formula and gaining weight, I knew he was getting, everything he needed, and he did get that those important parts of the breast milk in those first few weeks. So he did get some benefit from that, but just watching him grow and thrive.
That's the most important
really
thing, isn't
rewarding.
it? So for you found out it might be a bit of a myth, that whole thing about every woman can breastfeed and we all have the capacity to breastfeed. And what sometimes happens is it just doesn't work.
Yeah.
So how were you both? Were you both unhappy while you were trying?
Yeah, Thomas, sometimes he'd be inconsolable because he was so hungry. He'd just really be unsettled, and that affected his sleep as well, and settling, and
so
that was affecting my sleep.
Yeah, so neither of you enjoyed feeding.
Once he was getting satisfied and getting full with the bottle milk, everything else kind of fell into place.
And you both enjoyed feeding.
Yeah.
And you know what's really important is not whether you bottle or breastfeed. Of course, breastfeeding is natural and it's wonderful, and it is the best, proper milk for babies, because that's obviously why we produce milk. But it is just nourishment. And if you can't breastfeed, what's most important is you enjoy the feed together. And for both breastfeeding and bottle feeding babies, the most important thing about the whole feed is that you enjoy it together. Because just imagine if you sat down to a meal with someone every 4 hours and you argued and you didn't enjoy it, you wouldn't want to do it very much. And that's why Thomas was telling you, he was saying, I don't like feeding like this.
Yeah.
This is really awful. And neither of you were enjoying it. And so it was affecting everything. It was affecting your relationship most importantly. So what's most important about feeding, whether you breastfeed or bottle feed, is the relationship you're developing. Because the thing about feeding is we do it so frequently, and if there's about 2,000 feeding interactions in the first year alone. So if you think about it, you need to get them right, because at this age, that's when your baby's mostly awake, and that's when you have your most social interactions. So it's really important that you enjoy it and that you talk to each other during the feed and you make lots of eye contact and you really enjoy it. And the other thing about feeding is that it's the first time you start working together as a team, and that's going to reflect how you work as a team all through the first year and onwards. So feeding is so much more than just giving your baby some nourishment and something to eat.